Good morning, my name is Faye Bruce. I'd like to take this opportunity to say welcome to our launch event. It's our signature launch today. Thank you for attending. We've got lots of entertainment for you, lots of information, and we really want you to enjoy the day. This is part of a journey that we'd like to take you on with us, and we'd like to engage you, just not today, but also for the future.
Hello, I'm Esther Oludipe, and I'm Director of Faith Partnerships in CAHN. Our mission is to lead, educate, support, advocate, and enhance
the work of the Caribbean and African organisations so that they are empowered
and enabled to improve and sustain the health and well-being of our community.
Should we just have three tables for them so we know?
I'm Jon Rouse and I'm Chief Officer of the Greater Manchester Health and Social Care Partnership. First, can I just say how much we welcome CAHN and its development and its welcome onto the scene for them, and we hope that they're going to be a really key partner for us in the years to come as we get a better understanding of Caribbean and African health needs and hopefully reflect them better in our policies and plans. And in terms of devolution, well, I suppose one of the most important things is it gives us an opportunity to do this type of engagement, in that previously decisions about how monies were spent for health and social care were made by people in the corridors of power in Whitehall. And in April 2016, that stopped being the case. We took responsibility for over £6 billion of health expenditure here in Greater Manchester. So I think there's one big difference with this set of changes, which is previously it was the same national top-down model and just rearranging furniture really, or rearranging deck chairs. This is different because power has actually shifted from the national to the local, and now we have to shift it again from the local to the community level. That is a huge change in the model of care. How will we know we've succeeded? Over the medium term, if we take a 5 to 10 year period, then it should be about improved outcomes for people, and prominent amongst those should be a reduction in the inequalities that we see within Greater Manchester's communities. So I think there's two key dimensions to this. So the first is that we actually tackle disease types that are most prevalent amongst those populations where we've got the greatest inequalities. So if we're talking about the African and Caribbean community, that would mean all the investment we've made in improved stroke care. It means improvement in diabetes. It means lobbying sometimes NHS England as a national body to invest in things like sickle cell disease. It means our HIV eradication programme. All of these are relevant. There's a really important second dimension as well, which is about reach, and it's about engaging with BME communities across Greater Manchester through the organisations that they trust and know, which might be a voluntary and community sector organisation, or it might be a faith organisation, or something like that, rather than believe that we as statutory agencies are going to be able to reach those populations by ourselves. We definitely want a long-term relationship with CAHN. I've already said that this is a great evolution for us. It gives us an organisation now to work with, a network to work with over the coming years. So we want to build and help you build your capability and capacity and become a really strong and effective partner for us. So thank you.
Our vision is to transform the way the Caribbean and African community access appropriate information and resources that enable them to improve their holistic health and well-being.